Dr. Thuy Ho-Ellsworth with us from Align Foot and Ankle. Thank you for being here.
Thank you for having me.
I wanted to talk to you a little bit about regenerative therapies.
Yes.
It's a phrase or a word or a procedure that a lot of people may not be familiar with, but it's a very less invasive procedure for a variety of podiatry issues that you treat. Tell us about it.
Let me tell you, regenerative therapy has changed the face of medicine. Before, you had conservative treatment, and then if that failed, you had surgery. You had to go to surgery. And now with regenerative therapy, it's really filled that huge missing gap. What can we do if conservative treatments have failed? And now what we're doing is we are harnessing the body's potential to heal itself. When we do these biologic injections, or we're using different modalities like shockwave therapy and laser therapy, we are sending out a bat signal to the entire body, your body, and letting it know that, hey, let's focus everything here. And it sends all the healing factors it needs to try and heal that area.
Because some people live with those kinds of issues for years and years, and the body just kind of overlooks it because
it's chronic.
It's chronic, and you are compensating for it, that sort of thing. And the regenerative therapy allows your body to have the ammunition to repair itself.
That's perfectly phrased.
Yeah.
And when chronic issues persist, your body just walls it off, ignores it. It goes on. It just feels like it's hit the end of the road. There's nothing more it can do. But when we go in and we intervene, when we're doing things like shockwave therapy, these acoustic sound waves that strike that area and basically wake it up, increases circulation to the area, increases collagen production, basically elevating the support tissue and waking it up to try and heal that area.
Reestablishing the blood flow, that
yes,
sort of thing. Yeah.
Yes.
Interesting. That's great.
It's amazing what you can do now without the need for surgery.
Let's talk about minimally invasive surgery or procedures, the tiny little pinhole pricks, that sort of thing. Some people are afraid of surgery, the pins and needles and screws and a boot for 6 months and, I got to come back for therapy and things like that. And that is not the case at Align Foot and Ankle.
No, we do things very differently. As a podiatrist who's been practicing in Austin for over 15 years, I was traditionally trained. So I know what's out there and what we typically do. But in the last several years, I've obtained my fellowship. I am now an instructor in minimally invasive surgery, and I'm also the president of the American Board of Podiatric Regenerative Medicine. I have poured my entire heart and soul and passion into this industry or this niche of podiatry, and it's really changed things. My patients come in, they feel the difference. And what we offer and what we do at Align Foot and Ankle is very, very different than your typical standard of care.
Who are your typical patients? It's everybody, I would think, right?
I get everybody from pediatric patients to student athletes to University of Texas students to University of Texas professors to patients in their 70s, 80s, and 90s still playing pickleball, still active, and your general, middle-aged professional athlete, everybody from blue-collar worker to people who are training for marathons and triathlons and Ironmans. So we really cover the gamut of our patient population.
Let me ask you one more thing. It's got to be something special. Somebody that's been walking around in pain for years, you fix them, and in a matter of hours, they're back on their feet. Just seeing their face, how you have restored their quality of life, that's a big deal. That's freedom. That's the freedom of movement. It's a big deal, I would think.
Yes, very much so. And I take so much pride in creating a center of regeneration and restoration. And when you walk in with foot pain and walk out with relief and knowing that there's a plan, that is the most rewarding thing for me.
It's Align Foot and Ankle, online at alignfootclinic.com. Is that where folks should begin to schedule a visit?
Yes, schedule a consultation, and you'll be very impressed with the very first visit. I take a lot of time with my patients. I'm extremely thorough, And I go through everything from your foot structure to what you should be wearing, and then what is the next step that we can do to help you alleviate your pain. And most times, people are shocked that they can walk out pain-free that same day.
Yeah, that's great. Do me a favor. Look right here.
Okay.
And say something like, I'm Dr. Thuy Ho-Ellsworth from Align Foot and Ankle.
Okay.
So just that short. Do that.
I'm Dr. Thuy Ho-Ellsworth from Align Foot and Ankle.
That's beautiful. That is awesome.